everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Ciprofloxacin. Its brand name is Ciloxan. Before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So ciprofloxacin is a fluoroquinolone antibiotic that has broad spectrum action. It prevents bacterial DNA replication, transcription, repair, and recombination. It achieves this action by inhibiting topoisomerase 2 and 4. In terms of indications for use, I did mention in the beginning that ciprofloxacin has broad spectrum action, so it can be used in many different scenarios. I'll list off a few of the indications here now. Just keep in mind that this list is not all-inclusive. It can be used to treat bacterial conjunctivitis, as well as bacterial prostatitis. Bronchitis, as well as gonorrhea, can be treated with ciprofloxacin. It can be used to treat anthrax poisoning. It can also be used prophylactically in this setting. Lower respiratory tract infections can be treated with Cipro. Some ear infections, as well as pyelonephritis, can be treated with this antibiotic. And sinusitis, as well as urinary tract infections, can sometimes be treated with ciprofloxacin as well. Now, before somebody was to use ciprofloxacin, there are some contraindications they must clear, as well as some precautions and warnings that they should be made aware of. Ciprofloxacin cannot be administered with a medication called tizanidine. And this medication would also be contraindicated in patients who have a hypersensitivity to ciprofloxacin or other quinolones. Patients who have an aortic aneurysm who use ciprofloxacin may put themselves at an increased risk for aortic dissection. Patients should be made aware that this medication may cause QT prolongation. We would want to avoid this medication in patients who have known QT prolongation, in patients with uncorrected hypokalemia or low potassium, or with class 1A and class 3 antiarrhythmic agents. The use of zolpidem should be avoided with ciprofloxacin. Ciprofloxacin should not be taken with milk or calcium-fortified juices. Moderate to severe photosensitivity or phototoxicity has been reported with ciprofloxacin. Blood glucose disturbances, including symptomatic hyperglycemia and symptomatic hypoglycemia, have both been reported. Severe and sometimes fatal hepatotoxicity can develop in patients using this medication. If this is to occur, it most commonly occurs in the 1 to 39 day range after starting the medication. Hypersensitivity reactions, which can sometimes be serious and even fatal, have been reported. So the medication would be stopped at first sign of rash, jaundice, or other signs and symptoms of hypersensitivity. Tendinitis, as well as tendon rupture, has been reported. This could occur bilaterally and has happened during the initial dose as well as just days after using the medication. Status epilepticus has occurred in patients using ciprofloxacin, so patients with convulsive disorders should use ciprofloxacin more cautiously. Ciprofloxacin should be avoided in patients with a history of peripheral neuropathy. Some psychotic-like adverse reactions have occurred, such as suicidal thoughts, hallucinations, paranoia, or depression. Confusion, disorientation, as well as occasionally memory impairment may occur with fluoroquinolones. And finally, a dose adjustment may be required in patients who have renal impairment. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use ciprofloxacin, they can expect to receive their dose in tablet form. For mild to moderate skin infections, patients may try to use 500 milligrams of ciprofloxacin every 12 hours for 7 or 14 days. For severe or complicated skin infections, we would use 750 milligrams every 12 hours, again for 7 or 14 days. And the dosing for lower respiratory tract infections seems to be the same. So if it's mild or moderate, 500 milligrams twice daily, 7 or 14 days. If it's severe, 750 milligrams twice daily, 7 or 14 days. For the treatment of anthrax, a patient would use 500 milligrams twice daily for 60 days. Patients treating an outer ear infection may use the ciprofloxacin drops, in which case they would use the drops every 12 hours for 7 days. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using ciprofloxacin, so I'll go over some of those here now. About 1.8% of patients may experience a rash. Upwards towards 3% of patients may experience diarrhea. About 1% of patients may experience vomiting or headaches. More rare but serious side effects would be delirium, the development of depression, hallucinations, diarrhea caused by Clostridium difficile, and finally, agranulocytosis. That's all we're going to talk about today with Ciprofloxacin, or Ciloxan. As always, I'm thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.